Immunology, baby, is all about license to kill. Oh, the lead. Do you see that? License to kill. Immunology. Study of the immune system. Logy, study of immune. Immunology, study of the immune system. That's what it's all about. It all starts with this little word with a big meaning. It's called antigen. What the heck is an antigen? It's anything. As the book says, it's any definable moiety. I'm not sure what a moiety is. I don't know if it's square or circular or what. But anyway, it means it's anything. You look at a piece of glass, doesn't look like an antigen. But then you have a disease called silicosis. You got a Barbie doll shoe. Doesn't look like an antigen, does it? But if little Bobby aspirates it, how come you get a granuloma? So that's what they mean by anything can be an antigen. However, for test-taking purposes, if asked what an antigen is, proteins, over 90% are proteins. That means you got to pick that one. Because all the answers will look right. That's the trick to the question, is make all 5 answers right so that you start panicking and just guessing. Protein, number 1. Carbohydrate, number 2. Okay? There's only one lipid known to be antigenic, and Benish knows who it is. The only lipid known to be antigenic, and Benish knows who it is. We got to phone a friend. Faisal! There's only one lipid known to be antigenic, and you know what it is.
Oh, I know.
Oh, now it comes to her. Now she's not on the spot. Ooh, that cortisol died down since I left, huh? All right, wait a minute. Faisal. No, oh, I'll let her speak. Oh, isn't Faisal so kind? Okay, Benish. Cardiolipin is the only lipid that's antigenic. So, again, the questions they love to ask, what is an antigen? Pick proteins, because all of them can be antigens. And then they love to ask about the lipid. There's only one lipid known to be antigenic. Lipids generally are the worst antigens. Okay? So that's why we got to know about antigen. Well, you got to divide up antigens into 2 types. 2 types, because normally when you ask a student what's an antigen, they start talking about stimulating the immune system. I say, well, you forgot about the other half. Okay? So be careful about picking that answer now. An antigen can be anything. Well, a hapten is one type of antigen. It means that it's too small to set off the immune response. The cutoff number they want you to know, Dan, 6,000 Daltons. A hapten is an antigen. Too small to set off the immune response. The cutoff number, 6,000 Daltons. What is an immunogen? It's an antigen that's large enough to set off the immune response. Again, begins at 6,001 Daltons. Everybody understand? 2 types of antigen. A hapten, too small to set off the immune response. And an immunogen, large enough to set off the immune response. Okay? Well, 6,000 Daltons, more than 6,000 Daltons. Now you may say to yourself, Dr. Francis, size doesn't matter. Really? In immuno, it does. However, the most important factor that governs immunogenicity is not the size. It's called variability. It's how different do you look? How different do you look? If you look different, you're more likely to capture attention than when you look the same. Isn't that a true statement? All right, check it out if we apply it to real life. Let's say you're walking through Cabrini Greens, one of the most dangerous projects in Chicago, if you dare enough to walk through Cabrini Greens. All right, so you want to make it 2 blocks. Okay, you're feeling pretty good today. All right, so you start walking. Well, if you're black, maybe 5'8", you're wearing Nike shoes, Rockaway jeans, maybe a G-Unit shirt, starter cap, make sure you tilt to the side, put a little slink and you walk. You might make it a couple of blocks. I say might. Because maybe there's somebody out taking target practice. That's what makes it the most dangerous projects around. Because sometimes they're just shooting for the heck of it. Okay? So you might make it through. Why? Because you look like everybody else. Everybody understand me so far? Well, let's say you're 6'11", Caucasian, from Texas, and you decide you're going to wear your boots today, and a big old cap coming way out there, and you just walking, and then you got the nerve to be jingling change in your pocket. Oh, my God. You're going to set off one heck of an immune response, man. Neutrophils everywhere, ready to kick your butt now. Because you don't look like anybody else in that neighborhood. No matter how much slinking you walk you got, you still don't look like anybody in that neighborhood. They're going to get you. Same thing in your body, folks. If something looks different, your body has to attack it. Everybody follow me? Let me show you something. One good example of a hapten. What's the definition of a hapten? Under 6,000 Daltons. Can't set off an immune response. One good example is a virus. Just a few microns. That's pretty small. It's a virus. Kathia. That means most viruses don't set off immune response. You understand that, Kathia? If I say most viruses are haptens, they're not capable of setting off the immune response. Do you understand me, Kathia? You understand that statement? By themselves. They cannot set off the immune response. You understand that now? However, Kathia, what if I tell you there are viruses that still set off the immune response? What does that tell you? No, they're all about the same size. What does that tell you, Tara? What is the number one factor that governs immunogenicity, Tara? It's called variability. It's not the size. It means the viruses that hurt you, folks, I bet you there's something different about it that you better know. Why do you think with the flu they want you to know about genetic drift and shift? Why do you think they want you to know about H and N antigens, about measles and influenza A? Check it out, check it out, check it out. That means any virus. Folks, if you want to know why it makes you sick, you better know what's different about that guy. Big picture, big picture. Because on any given day, guess what? 95% of people walking around with CMV in their blood, and you're not sick. 70% of people walking around with EBV in their blood, and you're not sick. Why? Because they're haptens. Does everybody understand? Does everybody understand? Cool. We'll tie it all together later. So the most important factor that determines immunogenicity is not size, it's variability. So let's take a hapten again. A hapten means it's too small to set off the immune response, right? Or to lead. The question is, how can I take a hapten and make it more immunogenic? Everybody follow my question? That's called a carrier effect. This is what your macrophages do for a living, or to lead. You understand, Kathia? This is what your macrophages do for a living. What do? Step one. These steps you got to know, folks. That's why it's written down for you. They ingest it. That means they eat the antigen. The lysosomes wrap around it, phagosome formation. Then they digest it. Remember, they release the enzymes after they wrap around it. Then they break it up into pieces and present it to you. How do they get presented? On the MHC2 complex. 2 complex. Here it is, sitting on top of the macrophage like that. After the antigen's been chopped up, all of a sudden a little piece of it comes pushing out like that and then presents itself right here on the MHC2 complex. MHC2 complex has an alpha and a beta chain. The antigen binds the beta chain, specifically the variable region of the beta chain. That's why they say V beta region. That's all that means. The good thing, Kathia, is when you bind that V beta region, all of a sudden the lock to the MHC2 box, the lock is called an invariant chain, gets pushed out of the way. And then boom, IL-1 is released into the medium. One more time. You got to ingest, form phagosome, digest, then present where on MHC2 complex? Specifically on the beta chain, specifically on the variable region of the beta chain. Once you do that, boom, the lock box opens up. Boom, IL-1 is released. Everybody with me? You with me, Andre? With me, Faisal? You understand so far, Faisal? You understand so far, Linda? All right. Once IL-1 is released, then inflammation can begin. Well, you know, somebody said, hey, I think I understand what the carrier effect is all about. Why don't we make use of that in the formation of vaccines? Well, check it out. They put it to work, Tina. To make vaccines, folks, we make use of the carrier effect all the time. How do we do that? Well, Tina, look at this. You have an immunogen. What does that mean? Greater than 6,000 Daltons, large enough to set up the immune response, right, Michelle? All right, and then I have a hapten. Tina, what does that mean? Too small to set up the immune response. However, Frank, what if I attach the hapten onto the immunogen? You know what your macrophages are doing for you all day? When the antigen is presented on this MHC2 complex, your body doesn't just see the antigen. It sees all of this. This whole thing becomes foreign now. Everybody follow that? Your macrophage is sacrificing themselves for you. For you because they love you. Because they love you so much. Oh, Mommy, I love him so much. Hey, so here we got a hapten and an immunogen. That means when I inject both of these into your body, Tara, will your body respond to the immunogen? No, I never asked you about hapten. I said immunogen. No writing campaigns. Yeah. All right. So when I inject this whole complex into your body, the body will respond to immunogen. Everybody understand that, right? Will the body respond to the hapten as long as it's attached to the immunogen? Does everybody understand? That is a true statement. The body will respond to the hapten while it's attached to its immunogen. Well, let's bring it to life. Let's say I take Hib, H influenza B, take a little piece of it. Because if I take the whole thing, you'll get the infection. So I don't want the whole thing. I just take a little piece of it. Put it right here. Attach it to the immunogen. Everybody with me so far? Now, will your body respond to the immunogen? Tina? Yes, it will. Will it respond to the Hib on top of it? Yes, it will. Everybody understand that? That's how I get your body to respond to the Hib, and yet you've never had the infection. That means now you have active immunity, Kimberly. That means you have IgG to Hib, and yet you've never seen infection before in your life. And that means, Kimberly, you're smiling too big. I like this. Because that means the first time you come in contact with Hib, you have IgG to fight it. That's the best defense. That's what active immunity. Two ways to get active immunity. Either get the infection or get a piece of the protein. Okay, that's what the carrier effect does, because that's the best type of immunity, active immunity. Okay? Hey, wait a minute, though, Kimberly. Check this out. Let's say I don't attach the hapten on here too tightly. And then when I inject it into you, by accident, it falls off. Will your body respond to this immunogen? She says yes with confidence. Kimberly, will your body respond to the hapten that fell off? No, wait a minute. No one less. Just tell me, will your body respond to hapten if it fell off? The answer is no. Say it with confidence, girl. Everybody understand? Ooh. Ooh, I like that. Anyway, you see how forceful she said that? Ooh, there's another side to Kimberly we haven't seen yet. Excellent. All right, you understand, though, Kimberly? The key is if it's not attached, it will not respond. Does everybody understand that? Because what if they ask you that when you give somebody a vaccine, it failed? I bet you I know how it happens. Sometimes it falls off. After you've injected it, folks, they will not respond to the hapten. You get a response to the imaging, but that's an image your body's used to. So you still have no immunity. So that means if the hapten is not firmly attached, you will not get a response. That means the person will fail the vaccination. That's why, like, when we give somebody, vaccination for hepatitis B, years later, what did I always tell you to do? Check their antibody level. That's how you know whether they responded or not. Because maybe they were one of those failures. And you'll check their IgG, says 0. Sorry. That means it fell off after it was injected into the person. And didn't work. Everybody understand me? All right. So that's hapten and immunogen. Okay? IL-1, what's it good for? Ought to lead wants to know, what is IL-1 good for? 3 things, ought to lead. Causes fever, non-specific symptoms of illness, and then recruits T helper cells. Fever, non-specific symptoms of illness, like anorexia, myalgia, arthralgia, malaise, that stuff that they fill up 3 or 4 lines in a vignette, worthless information. Folks, just seeing fever doesn't even tell you anything. Fever alone, folks, just simply said IL-1 showed up. Does everybody understand that? But you hear doctors all the time saying fever means he has an infection. Really? Where'd you read that one from? See, some experts said it, so everybody believed it. Oh, folks, then you're in for a rude awakening on the exam. Why do we have fever after an MI? I don't see an infection. How can we have fever after a PE? I don't see an infection. See my point? Don't believe that. I don't know who started that and said that's not true at all. Fever does not mean you have an infection. All it means to me, IL-1 showed up. Does everybody understand? That's all you can really tell me. And it's important that you understand you're going to recruit T helper cells with IL-1. Why? T helper cells are the ones going to process this antigen you're presenting on the top. Everybody see that? See how it makes sense? Makes sense of information so you remember it. So IL-1 ought to lead. 3 functions of IL-1 are to do what? Fever. And recruit T helper cells. And non-specific symptoms. Everybody clear about this? Well, what's the definition of fever? 1 degree above normal body temperature. You understand, Katia? Just 1 degree of, you understand, Linda? You understand, Binish? Do you understand, Tara? 1 degree above normal, you got a fever. You got a fever. Oh. What's the benefit of a fever? Number 1 benefit of a fever, folks, is to raise your heart rate. Why? Increase your BMR. Raise your heart rate 10 beats per minute for every degree rise. So that means if you come in with a fever 3 degrees above normal body temperature, Nicole, how many heartbeats are due to that fever? 30. Does everybody understand that? So that means 30. When a patient comes in with a fever and tachycardia, the first thing you should always do, subtract out the heart rate due to that fever alone. Does everybody understand me? So let's say you come in with 105 temperature. You're now 7 degrees above normal body temperature. How many heartbeats are going to be due to fever? Eros? 70. Here's how to get you an exam. You got somebody with 105 temperature, heart rate is 110. You say, oh, he's tachycardic. Do the math. With a 7 degrees above normal, how many heartbeats are due to that fever? Eros. 7 degrees above normal. How many heartbeats are due to the fever? 70 from 110 is what? And you're telling me this guy walks around with a heart rate of 40? I doubt it. Does everybody understand? Eros. Bring it together. Anytime somebody's heart rate is not as high as you predict it should be, if it didn't fall between 60 and 100, what's wrong with it? Anytime the heart rate is not as high as you would predict, I want to know what the disease is you should be worried about. Anytime the heart rate is not as high as you think it should be, what do you got to worry about, Joseph? What do you got to worry about, Monica? Nah, Dan, what do you got to worry about? You got to worry about heart block. Remember, we've said this several times. Anytime the heart rate is not as fast as you predict, folks, the patient has a heart block. Which means you might want to know the diseases they're trying to clue you into. And I'm going to tell you now, I have not, in all the years I've been doing this, it is a rare student whoever picks up this clue on a vignette. It sneaks right by you. Because you see 110, you think everything's cool. But you don't know to subtract out that 70. There's no way he's walking around with a heart rate of 40. That man has a heart block. The 5 infections that such a heart block that we need to know. Ought to lead. Read that list for me. Legionella. Lyme disease. Chaga. Diphtheria. And typhoid fever. So those 5 infections, folks, that's how they clue you in. They give you a child who's got a high fever, but when you figure out the fever and heart rate, his heart rate is too slow. Classic. He's got one of these 5 infections. This is all over Boris 2, Boris 3, because rarely does a physician figure it out. Because again, I remember I told you, physicians just keep reading numbers. Oh, heart rate is 100. Heart rate is 90. Instead of saying, well, in this context, should it be 90? You see? So these are the 5 infections where you got heart block. Everybody understand? All right, and of course you're going to learn how to separate all 5 of them. Anytime you have heart block and they're symptomatic, what do you have to do for them? Kimberly? No, you got a heart block. EKG already told you you got a heart block. How do you treat them? How do you treat this problem when you have a heart block and they're symptomatic? What do you do first? What? They're blocking some more? They already have a heart block. Elvis, rescue her. The rescuer, Dr. Francis, I don't know how to swim. She's on her own. He just lets you drown out there. All right, heart block with symptoms. What's the drug of choice, Tara? Help her out, Al. No, that's for heart failure. Linda. Andre. No, Rebecca. Heart block with symptoms. First drug you want to give them? No, that's for contractility. All right, Tina. It's called atropine. You already learned it, folks. I remember I told you, you got to recognize the clues so that you hear it and it triggers off the knowledge just like that. Heart block. Atropine and glycoparylation popped in your head. Atropine is just a drug of choice. That's how you treat them acutely, pacemaker permanently. Remember, on-demand pacemaker, I taught you what it does. It means the heart is not responding the way it should be. So put an on-demand pacemaker in there. For these infections, you may just have to put a guide wire and pace them for a few days till they get over the infection. Treat the infection, it should go away. Okay? But make sure you understand this. All right, so 1 degree above normal body temperature. First benefit, heart rate 10 beats greater for every degree. Number 2, benefit of fever. Allows immune cells to come around faster because your heart is pumping faster. Understand, Janice? Understand, Tatiana? It makes the immune cells come around faster. That means, Tatiana, if your immune cells come around faster, guess what? You get better faster. Does that make sense to you? Does that make sense to you, Janice? Then it should make sense to you that if you overtreat a fever, it's going to take you longer to get better. Does everybody understand that? Does everybody understand that? Big study. Children. One group got Tylenol for fever. The other group did not get Tylenol until the body temperature went above, I think, 101.5 or something like that. The group that got Tylenol, every time they got a fever, took a lot longer to get better. Folks, why is that important for you to know? Because moms think, and doctors perpetuate this whole belief, that every time a child has a fever, the fever by itself is a disease. Low-grade temperature, wham, full dose of Tylenol. Tylenol is toxic to what organ, Tatiana? Liver. Saw a pathologist in Ohio who told me the incidence of acetaminophen-induced hepatotoxicity is on the rise across America. Gee, I wonder why. Because nobody told mom that you don't have to treat fever every time they get one. Wait till it gets above 101.5. That's when they feel uncomfortable. Now go ahead and treat it. But otherwise, let the fever stay. Well, when you run around, Tara, what happens to your body temperature? Goes up. When you run around, Kathy, what happens to your body temperature? Goes up. Ever wonder why children pick up a virus, but because they're running around, they get better faster? Mom says, Johnny, sit down, lay down, you're sick. Good thing Johnny does not listen to mommy, because mommy doesn't know what she's talking about. Think about it, folks. Why is it elderly people who are bedridden die from that same virus? Because they weren't moving around. Oh. Dun, 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 dun. It's all right there, man. Folks, low-grade fever under 101, let it be. Teach the mothers, let it be. It's good for you. Wait a minute. Kathy, look at the third benefit. Causes secretion of IgA. Kathy, tell me again, where does IgA protect you? Which areas of your body does it protect? Mucosal surfaces. GI, GU, respiratory. Where do most infections come in? Al. GI, GU, respiratory. GI, GU, respiratory. That's why you need your fever. You need that as protection. Years ago, folks, anytime I felt a cold coming on, you know what I did? Hit the basketball court for 2 or 3 hours. Next day, cold is gone. I never knew why, but I do now. Check it out. In the old days, the cowboys up in the mountains, they would boil a hot pot of water and put their head over it and a towel over it. Why? So they get the heat to come in. Why do people in other countries in the middle of winter bathe in the hot springs? I got to break it down, man. Why do you think people go to the sauna or hot whirlpool after workout, especially during winter? I got to break it down. Why do you think your mama say you better have a lot of layers on when you go out in the wintertime? I got to break it down. Why do you think your mama tell you to eat hot soup and hot tea? Why? I got to break it down. Check it out. Heat in your body secretes more IgA. You stay healthier. Feel like I'm doing a movie up here or something. Hey, but does everybody see why the body temperature? Why do you think when a child gets a pulmonary infection, mom rubs Vicks Vapora, doesn't that release heat into his lungs? Right there! Tons of IgA. All of a sudden, little Bobby's better. Oh, that just happens. That's just what we see. Really? Everybody's forgotten the basic stuff. All right, fever, folks, 3 benefits. Make sure you know them. And then infections that cause heart block, please know them. Anytime you see a fever, folks, look at the pulse rate carefully and do the conversion. Because like I said, all these years, I rarely ever see a student, whoever does it, that heart block just goes right past them. I always got to bring it back. And then when we do the calculation, oh, now they realize, oops, missed that. That would have been the only clue in the whole vignette. Okay? Don't miss it. So fever, in my mind, or the lead simply means IL-1 showed up. Does that sound okay to you? Okay. Fever by itself cannot tell you the cause. You understand that from now on? That just means that so many causes of inflammation cause fever, so you can't say, oh, fever means infection. Don't believe that anymore. But the pattern of a fever can be quite diagnostic, as you're going to see, like malaria, Borrelia recurrentis. When the fever has a certain pattern, we can tell what infection is actually causing it or what disease is causing it. But your body becomes uncomfortable after 101. That's why under 101, leave it alone. Leave it alone. So now that's the hapten side. What about the immunogen side? How can I make an immunogen less immunogenic? Linda's asking herself right now. Okay, Linda, I'll tell you. I got to break it down for you. All right, so immunogen, I can't change the size, can I? Because the size is a fixed amount. Everybody with me? Can't change the size, but I can change how much of it you come in contact with. How am I going to do that? 3 ways. I'm going to use a detergent, disinfectant / antiseptic, or a sterilization process to do so. You understand, Rebecca? These are 3 ways to decrease the number of immunogens that enter your body. Do you understand, Rebecca? Okay, let's do one at a time. What does a detergent do? Disrupt the adhesion of a pathogen. You understand, Cammie? It's going to disrupt the adhesion of a pathogen. Hey, Cammie, did I say it's going to kill anything? Does everybody understand? You didn't kill anything? When you use soap, a detergent, to wash your hands, best way to do it, rub your hands for at least 20 seconds. What you're doing is, what? Disrupting adhesion. And then when you put it underneath the hot water, what do? You loosen them all up, they wash right out and go right into the sink. Everybody follow me? That's why we don't want children sticking their hand into the sink there. Why? There's live germs in there. You didn't kill anything. And then you take a bunch of it, throw it in a garbage bag. That's why we don't want children sticking their hand in a garbage can either. Why? There's live germs all the way in there. You haven't killed anything. Everybody understand? Okay? Put your clothes in the wash. Put some Tide detergent. What's Tide going to do for your clothes, Joshua? Oh, help me, Lord. Help me now. I got to help this young man. I got to empower this young man. Josh, just look up there on the screen. What does the detergent do? Disrupt the adhesion of the bacteria that are sticking to your clothes. That's why your clothes, if you disrupt the adhesion, the bacteria come off your clothes. And that's why you have a rinse cycle to whip them away from your clothes. While your clothes stay in the middle, the germs go away. I got to break it down, man. Is immuno in the wash cycle? Can you hear me? That's all it is. That's all the detergent does. Disrupts adhesion. That's why we need the next process called antiseptic or disinfectant process. Notice the word against sepsis, against infection. The main chemical that we use today is called phenol. Phenol is a strong alcohol. Remember we learned alcohol will destroy all membranes. Remember cell membrane, mitochondrial membrane in the liver? Everybody understand so far? So that means, Monica, the phenol will actually start to destroy the membrane of this bug. You understand? That means, Monica, if there's a toxin buried in the membrane, it will inactivate that toxin. Do you understand, Monica? But at the same time, Monica, can a bacteria live without its membrane? Really? Say it again. Say no, Monica. Can you live without your membrane, Monica? Can a virus live without its membrane? Say no, Monica. Okay, so does everybody see why this process is the one that kills 99% of your bacteria? All you got to do, phenol is the main chemical in Lysol. You ever watch the Lysol commercials? You're supposed to clean the counter with warm water or hot water and detergent. What's that going to do for you, Rebecca? You clean the counter with hot water and detergent. What's that going to do for you? What? Loosen up. Remember, disrupt adhesion of bacteria, whoever's on there. And then you come around and spray with phenol and then wipe it clean. What's it say on the commercial? Kills 99% of bacteria. Oh, Tamir. I think I know where they're getting that from, man. Right here, right here. All right, so like on board 3, they'll just ask you, mom is frantic on the phone, wants to know, what's the best way to keep a counter clean for a 2-year-old who puts their hand on everything? There you go. Tell her, clean the counter with hot water and soap, spray with Lysol and wipe. That way you kill 99%. See that? Come here, your question. Rubbing what thing? Oh, you mean that you buy from like the dollar store and all that stuff? Well, the key is if it says antiseptic disinfectant, then it does something for you. But some of them are just detergents. That means all you're doing is what if you use a detergent? Loosening up the germs on your hands so when you grab your burger, they're all in your burger now. So, folks, make sure you read the bottle carefully. It better say antiseptic on there, or else you're actually trying to hurt yourself with it. All right, so kills 99%. Everybody understand? All right, so that means then the last part is sterilization process. Sterilization process is only for killing spores. What's a spore made of? You got to know a spore is made out of a chemical called calcium dipocolinic acid. Calcium dipocolinic acid. We're only talking about 2 bacteria. Bacillus and Clostridium are the only 2 spore formers. So this is not about everybody. The problem, though, Jenny, is these 2 bacteria are very lethal if you let them get loose in your body. That calcium dipocolinic acid is so strong that nothing can penetrate it. Acids, bases, pressure, doesn't work. The only thing we find that works, 121 degrees centigrade, vaporized heat. It has to be vaporized even. If they just say 121, if they don't say vaporized, not good. That's a nice little trap. If it's not vaporized, because vapor can go through the tiniest nooks and crannies and actually get inside that spore and actually kill it. Everybody understand? So detergent, disinfectant, sterilization process. Okay? A good source of calcium dipocolinate is a clam. You know, clam. Got that one little pearl in the middle? Now, have you ever watched some of the submarine movies from way back? If you watch an old submarine movie, you hear things like, what are you hearing? That's the pressure from being underneath the ocean. Pressure trying to crack that submarine. So you always heard it, okay? So they duplicate that in the movies for you. But here's a clam. A little clam like this. Just chilling down the bottom of the ocean. But submarines going by. Thick walls, this thick. And you still hear, no problem. Protect that little pearl. All right. So that's why it's so tough that even that much pressure down at the bottom of the ocean doesn't bother a clam. Won't bother these guys either. Well, a spore cannot replicate. That's the good thing for you as the organism. A spore cannot replicate. So if you eat one spore, all you have is one spore in your system. But a spore can still release toxin. That's what's dangerous for you. Even though it's one spore, it can release a ton of toxin on you. That can still hurt you. Okay? What pisses off a spore to make it release its toxin? Camille, it's called heat. If it's not vaporized, the key is you got to use its temperature and it's got to be vaporized heat if you want to kill it. If you just come at it with a whole bunch of heat, you piss him off. Then he releases a ton of toxin. Right on you. You understand this? Allow me to illustrate. Bring it to life, man. Let's say you're a surgeon. You cut on somebody. After you're done with surgery, there's all kinds of E. coli on that scalpel. So what do? Throw it into a detergent. What does the detergent do? Huh? No, Tara. A detergent does what? Loosens up, impairs adhesion. The main detergent used in a hospital setting, iodine. That's why I got betadine wash, betadine scrub, betadine everything. Okay? Iodine. Phenol is in the general population. All right, so you pump it into detergent. It loosens up all the E. coli on the scalpel. Everybody with me? The nurse comes along later on and then transferred it into a antiseptic disinfectant to me. What's that going to do? Actually going to kill things by destroying their membranes. Everybody with me? Okay, so that means when you wipe it off, what percent of germs have just been removed? Michelle? 99%. So let's pretend, per Nima, there's one E. coli left over on that scalpel. One E. coli left over on that scalpel. That's okay. Why? Because E. coli doesn't have any endotoxin. That endotoxin got messed up in the membrane because the antiseptic did that for you. All right? So that means E. coli is not going to do anything to you. But then you take that scalpel and you put it into a plastic pack and cover it and you put a date on there. You know what that date is? You know what that date is, Brendan? How long it takes, somebody figured it out, how long does it take for E. coli to get its toxin back? That's the date. So let's say you use the scalpel before the expiration date, Jenny. That's okay, because as soon as you cut the patient, E. coli swims into the blood. But he's by himself, and he's got no weapons. And here he is, E. coli, trying to crawl through the system without getting killed. And he's got to walk by this lymph node, and he doesn't know that Tyrone and Darnell, T lymphocyte, are just chilling, playing Texas Hold'em, man. Tyrone said, hey, Darnell, I'm going to see your quarter, and I'm going to raise you to... Oh, Darnell, guess what I see? The nerve E. coli coming in our hood. I'm going to kill him. I'm going to kill him. And Darnell turns to Tyrone, man, come on. He's by himself. I'm saying, you better check. Make sure he's by himself. Yeah, he's by himself. E. coli, come here. Come here. Should I cut him? No, leave him alone. He's just by himself. He's just a little baby E. coli. E. coli, come here. E. coli. What? You are lucky. Darnell's on your side. You are lucky. He said, don't cut you, boy. Or else I'd have to, right here, right now. You can't be walking up in our neighborhood, walking around here like you own this place. Tyrone, Darnell, we own this joint. Don't ever come up around here again. Don't ever, what I say, boy? Don't ever, boy, get out of here. Start slapping E. coli all over here. Get out of here. E. coli starts running away. All right, scene 2. You use that same scalpel, except now it's the day after the expiration date. Oh, I shouldn't have done that. Why? Because E. coli is packing now. A week ago, E. coli wasn't packing. He was running. Today, he's packing. So, Tyrone and Darnell playing cards as usual. Here goes E. coli. All right, Tyrone, I'm going to see your 25 cents. I'm going to raise you a nickel. Darnell said, I'm going to see. Oh. Guess who's got. Oh, Lord. The nerve of this fool. We're going to have to kill him now. We're going to have to kill him. E. coli, come here. E. coli starts walking over there. Tyrone said, hey, man, he don't look that scared this time. I wonder what's going on. I don't know, man. Just be on your guard. Be on your guard. E. coli just walks up close. Dum. He just stands there for a second. Pew. All of a sudden, the jacket flies open. Guns come out blazing. Let me introduce you to my little friends. Bam. Shooting everything up in sight. Because now E. coli's packing. Before he wasn't, but now he is. And that's why, even though the scalpel looks clean, folks, it's not about, oh, it's clean, it's got more germs on it. No. Whatever germ, even if it's one, he now has his endotoxin back. One germ release enough endotoxin, they still kill you anyway. Everybody understand? Okay. So, detergent, disinfection, sterilization process. The most immunogenic bacteria out there is one called Shigella. All you need is 8 to 10 of them. Diana, and you got an infection already. You're going to learn from so many other bacteria, you need like 100,000. Do you hear me? That's a big difference. 8 to 10, 100,000. That's pretty immunogenic. That's virulent, folks. Okay? So Shigella is one of the worst bacteria out there. All right? Well, let's see. Kimberly, you want to enjoy this with me? This is good stuff. Can you handle this? All right. She says she's ready. Folks, you're about to have an incredible academic orgasm. Coming at you on a Tuesday afternoon. No problem. Because I got to break it down like this. Ready, Kimberly? There's 2 arms to the immune system. 2 arms. One arm is humoral, Kimberly, that patrols your blood. One arm is called cell-mediated, Kimberly, that patrols the tissues. That means, Kimberly, if you want to know who's stimulating your humoral immune system, where are you going to look? That's why we do blood cultures. That's why we check blood tests. That means, Kimberly, if you want to know who is stimulating your cell-mediated immune system, where are you going to look? In the tissues. That's how I know. You better biopsy something. Cut something out. I don't care if there's a blood test. I bet you that's not the best test. I bet you. I don't care what any book says. I bet you that's still not the best test. Folks, here's the basics if you want to learn it. This is how you know when a book is incorrect. This is how you know when an author is incorrect. This is how you know when your attending is incorrect. Because it does not match. It does not match. Humoral and cell-mediated. Kimberly. The cells that patrol your humoral immune system, they call them B cells and neutrophils. Do you see that, Kimberly? The cells that control your cell-mediated, the T cells and macrophages. Do you see that, Kimberly? That means, Kimberly, if I see B cells, which system is being stimulated? Humoral. If I see neutrophils, which system is being stimulated? Humoral. If I see T lymphocytes, which system is being stimulated? Cell-mediated. If I see macrophages, which side is being stimulated? Cell-mediated. That means if I see B cells, where am I going to find the infection? In the blood. If I see neutrophils, where am I going to find the infection? In the blood. If I see T lymphocytes, where am I going to find the infection? In the tissue. If I see macrophages, where do I find the infection? Wait a minute. That means if I got a B cell defect, where's the infection going to kill you? In the blood. If I got a neutrophil defect, where's the infection going to kill you? In the blood. If I got a T lymphocyte defect, where's the infection going to kill you? In the tissues. If I got a macrophage defect, where's the infection going to kill you? Immunodeficiency is covered, baby. Read. Tell me where you can read that fast. My job is to break it down for you. Bam. Every immunodeficiency. Look at it. Look at it. That's what I mean by no test writer can fool me. Because there it is. You can call it any name you want. All I got to do is figure out what cells are being affected. Bam! I'll tell you where the infection is going to happen and even what type of infection is going to kill your patient. Every immunodeficiency. Oh, Kimberly, you're still smiling. This is good stuff, man. I like this. I like this. What you got, Andre? Question.
I just wanted to know, is the orgasm finished already?
Let's see, we got cell-mediated impetus here, all right? Okay. All right, everybody understand the 2 arms? There are 2 arms. B cells, neutrophils, T cells, macrophages. Do you understand, Kimberly? Bam! Here's how they try to get you. They change the name of the macrophage, man. They change the name of the macrophage. That's all they can do. It's a word game, Jenny. It's a word game. Check it out. In the brain, they say microglia. In the lung, type 1 pneumocyte. In the liver, Kupffer cell. In the spleen, RES cells. Lymph nodes, dendritics. Bone, osteoclast. Kidneys, mesangial. Peyer's patches, M cells. Skin, Langerhans. And the blood, monocytes. and then connective tissue, epithelioid, giant cell, and then histiocytes. 3 names for the same thing, macrophage. Oh, man. All they can do is change the name. That means if they ask me, what are you going to see with lupus nephritis? Why do you think they call it mesangial-proliferative? Oh, is that what they were talking about? That means if they ask you, what are you going to see in multiple sclerosis? Neuro, brain. Ooh, gliosis? Ring a bell to anybody? I bet y'all know where they got it from. Oh, you got histiocytosis X. Why is it starting your skin? Why is it starting connective tissue? Folks, they can't hide the truth. You got to know the truth. Because the truth will set you free. Isn't that right, Kimberly? Amen. Say amen, Kimberly. Amen. Amen. Hallelujah up in here. That's right. All they can do is change the name, Kimberly. All they can do is change the name. They cannot change the truth. Well, the 2 arms immune system, Kimberly, look at that. Humoral immune system is all about bacteria. Wait a minute, cell media is all else. Kimberly, can it be this simple? Kimberly, can it be this simple? Kathia, can it be this simple? Why didn't they just tell me this in medical school? Why didn't they tell me every bacteria has the same doggone response? Why didn't they tell me everything else has the same response? Because it's been too easy. It takes 5 minutes to teach the whole class. But no! 6 weeks of micro and immuno. And by the end of the 2nd week, I can remember what we had. What was in Staph aureus again? What were we doing in strep? What was it? Oh, strep pneumonia. No, it wasn't strep pneumonia. What do you see them? I have no idea, man. All I'm telling you, Kimberly, if they ask you, what cellular infiltrate you're going to see in E. coli meningitis, you say what? What are you going to see? Cellular infiltrate. Bacteria. So tell me, what are you going to see? Cellular infiltrate. B cells and neutrophils. Kimberly, if you got E. coli gastroenteritis, what cellular infiltrate do you see in the stool? B cells and if you got E. coli UTI, what are you going to see in the urine? B cells and you got E. coli rash, what are you going to see in the skin? B cells and, oh man, you got Klebsiella pneumonia. What cellular infiltrate you see in the lung? Huh? I thought Klebsiella was a bacteria. You got Klebsiella pneumonia. What cellular infiltrate do you see? Klebsiella UTI. What cellular infiltrate do you see? You got Staph aureus gastroenteritis. What cellular infiltrate do you see? I got a virus. What am I going to see now? I got a fungus. What am I going to see now? I got a parasite. What am I going to see now? I got a protozoa. What am I going to see now? I got neoplasm. What do I see now? I got a parasite. What do I see now? I got to bring it. Give me 5. Give me 5 up in here. Give me some elbow room up in this joint. They've been hiding the truth from you guys because it's too easy. Too easy. That every bacteria, same answer. Everything else, same answer. You got to be kidding me. Al, you got lupus. Lupus cerebritis. What cellular infiltrate you going to see? Lupus, discoid lupus of skin. What cellular infiltrate you going to see?
I'm going T cells and macrophages.
Lupus hepatitis. What are you going to see?
Macrophage and T cells.
Lupus nephritis. What are you going to see?
T cells, macrophages.
Lupus in your left eye. What are you going to see?
With my right eye, T cells.
Good ass. I like that one. Can you believe that? That means if they ask you, like, you got syphilitic pneumonia, they know you never heard about syphilis and pneumonia. But they'll ask you stuff like that. What kind of cellular infiltrate are you going to see in the lung? Folks, I bet you the answer is the same. I bet you the answer is the same. Well, what's under all else? Look at that. At the top, Bernema, virus. At the top, Diana, virus. Fungus, mycobacterium, protozoa, parasite, neoplasm. Do you understand, Diana? You understand? What's the most common infection under all else? Diana, virus. Hey, wait a minute. What kind of cellular infiltrate are you going to get with a viral infection? T cells or macrophages. Is it going to be interstitial or airway problem? Remember, bacteria like airway, everybody else likes interstitial. You see, folks, we got all the pieces. You can figure out anything about any inflammatory disease you want to know now. Now we're just adding cellular infiltrate. There it is. Hey, wait a minute. Diana. If you got a macrophage in the brain, what are you going to call it? Microglia. In the lung, what are you going to call them? Type 1 pneumocytes in the liver, what are you going to call them? Kupffer cells in the skin, what are you going to call them? Langerhans cells in the Peyer's patches, what are you going to call them? M cells in bone, what are you going to call them? Osteoclasts in the kidney, what are you going to call them? Mesangial cell. And in connective tissue, what are you going to call them? Epithelioid, giant cells, and histiocytes. Do you understand, Ellis? You understand, Maria? You understand, Michelle? Do you understand, Tamir? Oh, I don't know if you understand. I don't know about that. Nicole, what is the most common cause of gliosis? Bacterial or non-bacterial? Yeah. Non-bacterial. What's the most common cause of too many Kupffer cells in the liver? Bacteria or non-bacterial? Non-bacterial. Hey, wait, what's the most common cause of type 1 pneumocytosis? Bacteria or non-bacterial? Does everybody see what I'm talking about? All they can do is change the name of the macrophage to tell me you're in a different organ. Do you understand, Jenny? Do you understand, Janice? Do you understand, Tatiana? That means if I ask you, what is the most common cause of having T lymphocytes and macrophages anywhere? Rashmi, you say what? Yeah, the tissue infection, but what's the most common cause of having T cells and macrophages running around in tissues? Non-bacterial. And the top cause is what? No, the top cause on the non-bacterial is what? Look at the list. Virus. Wait a minute. She said virus. Did she not, Kimberly? Did you hear what she said? All right, Kimberly, let's connect. If she said virus, what's the most common virus that's going to cause a problem? Kimberly, you say? Yeah? No. Or the lead. The most common virus is going to cause this problem. What virus do you see in 95% of people, Kimberly? No. Kathy? It's called CMV. Which virus do you see 70% of the time, Kathy? EBV. Wait a minute, Kathy. You're telling me the CMV followed by EBV is the most common reason for T cells and macrophages. Is that what you're telling me? Is that what you're telling me, Kathy? Do you believe her, Kathia? Do you believe her, Nicole? Nicole, do you believe her? Do you believe her? Do you believe her, Tamir? Do you believe her, Terry? Do you believe her, Al? Do you believe it, Linda? Say, I believe. Say, I believe. I believe, Dr. Bay. I believe. Because I believe, therefore, the most common reason for having macrophages in your blood, Kathy, is what? Most common reason for having macrophages in your blood is what? A viral infection. What's the most common virus? CMV followed by. What do you call a macrophage in the blood? Why do you think they call them both mono? Get off me. Get off me up in here. Get off me. Back it up. Back it up. You guys never noticed it. My job is to enlighten you. Yeah, they call it mononucleosis. Ha ha. I know what they're really getting at. The number one and number two reason for having monocytes in your blood. Check that out. Cell mediated. This is the kind of stuff I'm telling you physicians just lose track of, and it's just something you read out of an article now. Not realize you could have figured that out on your own. That CMV number one, EBV number two for causing mono. Look at that. Whoa. All right, bringing it home, inflammation. Remember, less than 24 hours swelling. Neutrophils show up at 24 hours, peak at day 3. T cells and macrophages show up at day 4 and peak at day 7. And then fibroblasts show up at day 7, peak at 30, and take 3 to 6 months to finish. Isn't that right, Josh? That's right. Josh says, that's right. Ferdy, do you believe him? That's right. Do you believe, Ferdy? I believe, baby. Yeah. That means anytime they ask you about acute inflammation, Ferdy, look for swelling, look for cellular infiltrate, call neutrophils. Anytime they ask you about chronic inflammation, Ferdy, cellular infiltrate, T cells and macrophages. What are you going to see on biopsy? Fibrosis. What do you see on x-ray? Calcification. Dun, 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 dun. Check it out. Tending asked me, what are you going to see in Lawa disease? I have no idea what the hell Lawa disease is. But here's how I break it down. Well, from what I read and understand, Dr. Johnson, in acute Lawa disease, you should see about, in the first 24 hours, a lot of swelling. Let's say in the brain, all right? You see swelling in the brain. Acute swelling means increase in the cranial pressure. That means the patient complains of a headache. That means the sign would be papilledema. Well, if you wait a little longer, you'll see a neutrophil infiltrate that started at 24 hours, peak at day 3. After that, you see T cells and macrophages start at day 4, peak at day 7. If you continue to watch the patient, then you'll see infiltrate T cells and macrophages, fibrosis that start at day 7, peak at day 30, and take 3 to 6 months. That means if you want to talk about acute Lawa disease, I expect to see swelling as the main problem. That means increase in the cranial pressure. I expect to see neutrophils if I do a lumbar puncture. If you talk about chronic Lawa disease, I expect to see T cells and macrophages. On biopsy, I expect to see fibrosis. And then on X-ray, I expect to see microcalcifications. Look it up, see if I'm wrong. Look it up right now, see if I'm wrong. Look it up right now, see if I'm wrong. Because it'll kill you. You've been reading the same old crap for so many years, and you had no idea that's what it was. You had no idea where they got that information from. Acute cysticercosis. Look it up. Everything I just told you is the exact same. Sarcoidosis. Look it up. Everything I just said is exactly the same. Rheumatoid. Lupus. Look it up right now. See if I'm wrong. It'll blow you away. Oh, man. This is the kind of stuff I just love showing the experts. And then they realize, what? They had no idea. That's where all that information came from. Oh, my God, folks. Can it really be this easy? Heck yeah, man. 'Tis